Do you have trouble getting out of bed?
Trying to get out of bed.
Have you lost interest in things that you once enjoyed? Are you irritable?
I can't go!
Do you have persistent sad, anxious, or empty feelings? Excessive worry, restlessness, unwanted thoughts, feelings of impending doom?
Yes.
It sounds like you might need an SSRI. You should talk to your doctor about it.
What's an SSRI?
One of many psychotherapeutic drugs, SSRI stands for Selective Serotonin Reuptake Inhibitor. It's a second-generation antidepressant. Currently approved SSRIs include citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, sertraline, vortioxetine. While the SSRIs are primarily used to treat depression and anxiety disorders, this medication is also used to treat many other mental disorders, such as bipolar disorder, obsessive-compulsive disorder, panic attacks and disorders, and the list goes on.
It sounds like I am going crazy.
No, you're not going crazy.
Well, I am talking to a disembodied voice. Better? No, not really. Okay. Well, sometimes when we go through extended periods of stress, or we have to deal with a lot of different stressors in life, like school, job loss, illness, or a freaking pandemic, it can cause a reduction in neurotransmitters in the brain, like serotonin. Without the neurotransmitters, the brain cells cannot communicate well, which means that some of your brain cells may not activate the way they should. So how does the selective serotonin reuptake inhibitor help with this? It's in the name.
So here we have the postsynaptic neurons in the back corner, dealing with their daily stressors. And then there's the presynaptic neuron, attempting to facilitate some communication. And the neuron has put out the serotonin. The postsynaptic neurons haven't seen it yet. And oh no! The presynaptic neuron has taken back the serotonin. No communication this time. And here comes the presynaptic neuron with the serotonin. They haven't seen it yet. Will they in time? And here's the SSRI, stopping the serotonin reuptake by the presynaptic neuron. The serotonin has crossed the synapse, and there you have it, folks. Communication between neurons.
Okay, I see now, but can I even afford it? I am a broke nursing student after all.
Well, the cost of SSRIs can vary greatly depending on which drug and what dosage you're taking. They can range anywhere from $7.50 a month all the way up to $35 a month. It really depends on which pharmacy you go to and where that pharmacy is located. Supply and demand. But there are even some programs that you can get your prescription for as low as $4 a month. And if any of those prices seem daunting, most SSRIs are covered by most insurances.
I have been having a really tough time, so if I can get back to my old self, I most definitely will be talking to my doctor about this.
All right.
All right, Brittany, Dr. T here again. I'm going to start you on some sertraline, or you might know it better as Zoloft, 50 milligram tab a day. This medication is probably going to cause you some drowsiness, and probably be best to take it before bed. That way you're not trying to stay awake during the day or anything. Avoid driving or any other activities that you're going to need to be alert for until you are aware of how the medication is going to affect you. Don't drink any alcohol, take any other CNS depressants. Call us before and let us know before you start taking any herbal remedies to make sure that it's safe to, so it doesn't contraindicate with the medication you're taking. Keep good oral hygiene. It's going to kind of dry your mouth out, and you're going to want to keep up on that, or it's going to cause you some other problems. You can always chew gum, chew some sugarless gum, rinse your mouth out, whatever. Also, if you're going to be out in the sun, you might want to cover yourself up, be protected, as this makes you a little more sensitive to sunlight and stuff like that. If you're going to decide to get pregnant or try to become pregnant, call the clinic so we can reevaluate what we need to do as far as medications go. If you continue having headaches, weakness, nausea, anorexia, anxiety, insomnia, give us a call. Call us immediately if you have any thoughts of harming yourself or anything like that. If you begin to have any manic attacks or worsening irritability, aggressiveness, danger, or impulsive mania. Okay? You got any questions?
Nope, I know.
Okay.
Thank you.
Thank you.
Hi Brittany, I'm your nurse. How are you doing today?
Good, how are you?
Doing well. Okay, so I know you're studying to become a nurse, but the nursing implications for SSRIs are assessing for suicidal thought and tendencies, especially during the early treatment stages. You want to monitor appetite and nutritional intake as well as mood changes, assess serotonin syndrome, which causes mental changes, autonomic instability, and neuromuscular regulation. And GI symptoms also can occur. Sertraline may also cause false positive UA results for benzodiazepines. They may also lead to hyperglycemia for diabetes. Do you have any questions for me?
Yes, I do.
Side effects may include suicidal thoughts, dizziness, drowsiness, fatigue, headache, insomnia, agitation, anxiety, confusion, emotional lability, impaired concentration, manic reaction, nervousness, weakness, yawning, pharyngitis, rhinitis, tinnitus, visual abnormalities, chest pain, palpitations, diarrhea, dry mouth, nausea, abdominal pain, altered taste, anorexia, constipation, dyspepsia, flatulence, increased appetite, vomiting, sexual dysfunction, menstrual disorders, urinary disorders, urinary frequency, increased sweating, hot flushes, rash, diabetes, hyponatremia, back pain, myalgia, tremor, hypertonia, hypoesthesia, paresthesia, twitching, serotonin syndrome, fever, and thirst. For those experiencing depression or other mental health disorders, SSRIs can increase one's sense of well-being and lead to a renewed interest in their surroundings and life.
Thank you, random disembodied voice. Thanks to SSRIs, I finally have my life back.
Excessive worry, restlessness, unwanted thoughts, feelings of impending doom. Okay. One of many psychotherapeutic drugs. Blah 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 blah. Better? Sometimes in depression. Nope, that's not it.